Welcome to this class on Update on Law and Ethics, and my name is Dan Taube. What I'm going to be doing is, the first part will be, I'll be talking about kind of general issues of orienting ourselves and maintaining our ethical compasses. So some of the main kind of principles or suggestions about how to do that in the day-to-day work that we do and with the challenges that we face. Okay? Then I will switch gears, and I'm going to go to a model of talking about the ethical and legal issues we encounter from the point of first contact, which was something that you just asked me about before, through till termination. Okay, so I use an outpatient clinic or outpatient private practice model, and I realize that there's quite a bit of variety here in terms of where people work, and I'll speak to that in a moment. But that's basically the two halves. And what I'm going to do is I'm going to be relatively brief about HIPAA. I'm going to hit some highlights. There are about 4 areas that I want to talk about. One of them being this gnarly idea of what a psychotherapy note is and access to it. I also want to talk about the security rule, which went into place about 1.5 years ago, that still is mystifying to many of us. And I also want to talk about NPIs, the National Provider Identifying Numbers. Okay? To go back for a moment, I mentioned that I'm using an outpatient model. And not all of you work in an outpatient setting. Okay? So the question arises how this particular model might apply to you. Just that the idea of the point of first contact and when we do, quote, informed consent actually varies tremendously depending on your setting. Similarly, issues of how one structures the relationship and how you structure the service that we're providing vary tremendously. But the underlying issue of what we need to do for informed consent is very consistent across the board. Okay, so what I'll try to do is to highlight some of those differences, but if you're finding it a stretch to think about, well, how does this apply to me if I'm in a hospital setting and nobody calls me to set up an appointment, I get requested by the physician to go in and visit with a patient of theirs for 20 minutes in their room and do a brief behavioral evaluation. So although the model I'll be using is outpatient, I'm more than happy to respond to other environments and places because the application of it is not identical. The principle is very similar. Just suffice it to say, I don't believe in ethics expertise, except for a few of the bigs. So if you're the Baal Shem Tov or Jesus or Buddha or Muhammad, then you're an ethics expert. I'm not an ethics expert, and I'm not intending to represent myself as your externalized superego. What I think I have to offer is some information for you and a perspective on legal and ethical issues. Okay? I'm also not a member of the bar, thank goodness. That was my second masochistic period. And I don't practice law, so I'm not going to be giving you legal advice today. I'm going to be giving you my opinions about what laws say, the ethics codes, but if you have specific issues that are legal in nature, you need to get advice from an attorney. So with that in mind, let me move on to a rather kind of broad introduction, and I'm going to talk about a particular case some of you have heard of, the Ewing versus Goldstein case, and some of the subsequent law. You all remember the Yerkes-Dodson law? This is not a legal law. This is a psychological law. You know this one, of course. You know that there have been lots of controversies lately about whether it's true, although it seems to be sustained. It's around 100 years old. Its birthday will be next year. And the Yerkes-Dodson law was the inverted U shape around what was then called arousal, what we tend to call anxiety now, and performance and learning, particular performance. And the idea was that as anxiety increases or arousal increases, performance will initially increase. So I like to think of the first part of that curve being people have to be awake and attentive and interested and some kind of focus. But when you get past a midpoint in terms of this curve and you begin to get more anxious and then out at the end there we're terrified, our performance drops completely. It just falls apart. And similarly with learning, particularly complex tasks, complex cognitive and emotional kinds of issues that we do in therapy or that we might have to do when we're assessing someone, if we're terrified, As one of my wonderful supervisors from years ago said at LCSW, when mental health professionals are scared, they don't do so good. And it's true for all people, but for us as well. Now, the end of that inverted U is where most law and ethics classes seem to want us to be. We talk about how everything's really awful and also about all these scary things we're not in control of. All right? I'm not interested in scaring you. In fact, I don't think there's a reason to be scared. My sense is that, and what I'd like to do is engage your curiosity and engage your interest. I know that for many of us, and some of you will have some good news today about this, for many of us, the idea of having to do yet another required class in CE, it's like, oh, brother. And a CE class in law and ethics where we have to do it every 2 years, come on, right? Well, even though you're required, and even though I know for many of us it pulls for reactance, my belief is that most of my colleagues are very interested in legal and ethical issues because we encounter them every day. And we'd like to be able to deal with them in an appropriate fashion, in a way that really works for us, for our clients. So I want to engage that interest, not the fear. Some of what I'll be talking about today does get anxiety producing. I'm going to try to focus on what are the ways we can cope with the issues that arise and that can cause anxiety, and also what are some of the solutions we can use. Okay? So I'm not interested in scaring you to death. I'm interested in keeping your interest, which I consider to be my job, and engaging your curiosity, because this is a very fascinating area, and it's ever-changing. You know, there are some fundamentals that seem to be constant, and then there are all kinds of changes that happen. I managed to get about 10 different updates about legislative changes as of this past Monday. Okay? Now, they're not dramatic. They won't change your lives in many ways, but it's an example of how the law is continually churning and changing, and how we push on government to change rules. They give us some changes, not others, and then we have to adapt to the changes that we've asked for or that we haven't asked for. So the purpose here is not fear. So why, you might ask, am I going to talk about risk? Well, none other than Freud said that a life without risk was a life not worth living. Okay? So the idea isn't to eliminate risk. And in fact, I'm the last person who should be talking about not engaging in risky behavior. Okay? I started gymnastics when I was 47, and I'm still doing it. And I've had a number of injuries. And instead of being warned off of this ridiculous activity, I'm even more excited than I was 6 years ago. Okay? I also ski, and I ski rather dramatic terrain. I ski with my son, who's an expert skier, but I'm not that good. So risk is not a bad thing necessarily. But what I want you to focus on with respect to risk is that we should choose the risks we take. We should be cognizant and aware of what's potentially problematic and why it is that we're choosing to go in one direction versus another. All of you are very familiar with the Hippocratic Oath and what is, as a misnomer, said as first do no harm. Right? Actually, that's not the first thing in the Hippocratic Oath. The first thing is to do good. The first thing is to do good, to be beneficent. Then we try to avoid or do no harm. All of you know at one level or another that it is impossible to not do harm. Or rather, it's impossible that's correct, impossible to not do harm. The work we do causes people discomfort. The harms may be minimal, they may not be sustained. People may be willing to tolerate those discomforts. Sometimes they may be pretty significant. Change is uncomfortable, as all of us know. And in the process of doing therapy or having an assessment to tell somebody what it is they need to do, or to inform a court that a person should not have access to their children again, there are significant risks. And the issue is minimizing those risks to the extent that it's reasonable. But we will never reach the ideal of this Hippocratic Oath, do no harm. It just is not going to happen. You can't walk around and fail to do harm. We're going to do harm. So the issue is, how do we choose what we're going to do and try to minimize the harm and maximize the benefit to the people we're working with? And as you all know, while this is easy to say, it's a calculus that seems fairly straightforward, it is very difficult to do in the individual instance. Okay? So risks are natural. They're part of what we encounter. And the idea is not to get terrified of them. They're just there. The issue is, how do we address them? And what do we think about in the context of trying to manage risk and make reasonable choices for our clients and for us. There are two kinds of risk that we can encounter. And this is true, I think, for all aspects of our living, not just the work that we do professionally. I had a wonderful law professor, Dick Turkington, who died last year, and he was fond of saying that the two kinds of risks are thunderbolts from Zeus, those things we cannot anticipate, the fates, you know. For example, having, something completely out of expectation occur just would never be considered. Those types of issues, those are the thunderbolts from Zeus. Since we cannot do anything about those, we cannot prepare or we cannot say, I'm going to do X, Y, and Z now that there's been this risk that's now emerged, it's already happened. The best we can do, from my estimation, is to be decent, to try to have integrity in the face of these kinds of thunderbolts from Zeus, and do our best. Okay? The other kinds of risks, those risks that are what the law would call are foreseeable, there's a crucial distinction here, are the ones that professionally we are responsible for. Interestingly enough, though, we're not responsible for preventing all risks that are foreseeable. We're only responsible for meeting a standard of care. Kind of a curious idea, isn't it? So we have something that's foreseeable, so we should prevent it, right? Wrong. The reason it's wrong is very often we're not in control of the outcomes, particularly if we're doing outpatient treatment. The courts, our ethics committees, administrative law courts, all understand at one level or another that we can only be responsible to the degree that we have some control over the events that are happening.